Good afternoon, everyone, and thanks for joining us this afternoon. I'm Sean Godar, Vice President of Strategy and Analytics at Employers Health and Co-Director of Right Direction. I will serve as a moderator of this event. There's a few housekeeping items before we begin. All attendees are currently in listen-only mode. Submit your questions anytime in the chat function, and we will answer those during the Q&A session. We also encourage you to share with us some of the things that you're doing with your initiative in the chat as well. If you ever have any difficulties hearing me, please raise your hand in the control panel and we will be in touch to assist. Finally, you'll notice that there's a handout section in your control panel where you can download materials related to today's presentation. Upon exiting the webinar, you will receive a survey to provide feedback. We appreciate all attendee feedback in order to provide future valuable education opportunities for upcoming events. We will also send out a follow-up email tomorrow with a link to the recording of the event and its accompanying handout. Today's presentation is on how to make every month Mental Health Month, and it's brought to you by Right Direction. Next slide, please. Right Direction is a partnership between Employers Health and the American Psychiatric Association Foundation's Center for Workplace Mental Health. Right Direction is a free turnkey initiative focusing on increasing awareness, reducing stigma, and facilitating help seeking for mental health in the workplace. And the program can be used in conjunction with other mental health services and programs. With that, I'm going to turn it over to Darcy Gridadaro, Director of the American Psychiatric Association Foundation's Center for Workplace Mental Health and fellow co-director of Right Direction.
Thank you, Sean. And actually, great. I was going to say you can go to the next slide. So what we're going to do today, thank you all for joining us. We're delighted you're here. We are going to go through several slides that talk about kind of how you might plan your workplace mental health initiative. And then we're going to go through slides that direct you to places on the Right Direction site where you can get helpful information. And as we're doing that, you can get information directly related to what the slide is recommending. And that was part of the checklist in planning for your mental health initiative. And then Emma, who works with us, is going to be putting links to the material in the handout or chat section, I think the chat section. So, so you can actually see real time what we're recommending in terms of Right Direction materials. So with all good initiatives, we developed this checklist for planning for a workplace mental health initiative. And this is based on the many ways in which we at the Center for Workplace Mental Health and Employers Health have worked with employers of all sizes, from small mom and pops to Fortune 50 companies, in understanding how to plan for your mental health initiative. So obviously, first you want to identify goals and objectives, identify who should be involved, and we're going to cover each of these. Decide on the programming and resources that you want to use in your initiative, and then determine how you'll measure success. Create your implementation plan, which is timing and more details, and then let's launch. So we're going to go through each of these steps with a little bit more information. So if you go to the next slide, in terms of identifying goals and objectives, we are sharing what could be your goals and objectives for your initiative. Again, this is specific to your organization, specific to your culture. So really make these work in a way that works great for your organization and the industry you're in and so forth. But here are some ideas. Certainly raise depression awareness. It could be raise depression and anxiety awareness, but we know with depression that there's a growing need of people, there are a growing number of people experiencing depression. We also know that only half of people with depression are identified and receiving treatment. So raising awareness and communicating as the second step, communicating the importance of connecting to care is extremely important. The more as an employer you communicate that, the more people feel psychologically safe, see it's visible, and recognize the organization really has a culture of caring. So communicate the importance of connecting to care. Cultivate an environment that facilitates and encourages help seeking. Again, this gets to the fact that only half of people with depression are receiving treatment. So you want to really create that culture where it's highly encouraged that people get help when they need it. And then also learn about employee needs related to mental health and well-being, and we're going to talk about how you can do that. And then creating a culture that shows more broadly the organization's commitment to mental health. So if you go to the next slide, as you're thinking about your mental health initiative and who's involved, it's really important to involve as many as possible. So often these initiatives are led through the HR area, which is great because human resources has a very good sense of the needs of the organization around health and well-being. But it's always helpful if you can get leadership involved because leadership really sets the culture of the organization. And the more people see their commitment to mental health, the better. Also, if you have an EAP, Employee Assistance Program, it's really important they know you're engaging in this initiative, and you may want to ask them how they can contribute. Resources, time, presentation opportunities, really tie your EAP into it. Also, if you have an employee resource group, we know there are a growing number of organizations that have mental health and well-being, stress management, resiliency, mindfulness, ERGs, employee resource groups. So think about involving them. They have creative ideas and they've been talking about these issues within their group. So they can bring those as you're doing your planning, and they can bring really creative ideas they've heard from their group. Communications is key because communications, of course, can help you with messaging. They understand distribution channels within the organization, and they're really professionals that work within the area of getting the word out. Influential team leads is really helpful because you know the people within your organization who others look to and say, you know, wow, really respect my colleague, Jane. Jane is amazing. So when Jane does something, people really pay attention. When Jane buys in, when Jane gets active. So really think about, are there influential team leads who could be our ambassadors as we're engaging in a mental health initiative? And then others, you may have others within your organization who are obvious key players in planning for and implementing a mental health initiative. Next slide. Then we get to programming and resources. This is really about what's the meat of it? What are we going to deliver? What are we going to share with people? And there are many things you might consider. And again, you don't need a big budget for this. Many of these things can be done on a shoestring. So the first thing is speakers. And for those of you who participated in our previous virtual town hall on changing the conversation, we engaged with the Stability Network. The Stability Network is a group of professionals who all live with diagnoses and are professional speakers and work at a high professional level. And they are a wonderful organization to engage with if you want to have someone come and talk about what it means to live with diagnoses like depression. That is, by the way, the best research-based way to really tackle stigma because people have perceptions and there are myths and stereotypes around mental health issues. So the more you can bring in speakers who live with diagnoses to show, you know, it's really busting some of those myths and stereotypes to see that people achieve great things when they have diagnoses, and really you can chip away at stigma. Lunch and learns, we've been doing lots of lunch and learns, so especially in a virtual environment, but it doesn't have to be a virtual environment. You can have everyone within the cafeteria and you can have a virtual speaker who's doing a lunch and learn, maybe around depression awareness, strategies around help seeking. This really sends the message when you have lunch and learns that mental health matters to your organization. You might want to have town halls. We're hearing more and more about large global organizations that are having small, regional-based town halls to really dig into some of the mental health issues. Maybe you might make it around stress management or raising resiliency or depression awareness. So topical town hall meetings are great. Maybe you have an organization-wide if you have a smaller organization. Posters, and we're going to share how you can use Right Direction posters, but posters send a message whether they're posted on an intranet or in the halls of the organization. They send a message that you care about mental health and well-being, and again, it's making it visible. Fact sheets, infographics, training and education, workshops, intranet postings. Often what we hear from organizations is when they put information up on mental health on their intranet and they look at their data analytics around their web analytics, they find that those are often the most frequently reviewed materials in their health and well-being sections. And then if you're going to think about a perk around mental health, think about announcing it as part of your mental health initiative. So whether it's we've added a new meditation and mindfulness app or a new coaching app, or we've decided to offer 20 free counseling sessions to our employees. These are things we know organizations have done. When you announce it as part of your initiative, it just is a nice little bonus to really build up the existence of the initiative and really to get people excited about it. Next slide. Then when you think about measuring success, and again, this is the idea of hearing from employees is to survey employees. So maybe you've had a lunch and learn, or you've had a session, an educational or training session around depression awareness, and you want to do a quick survey of employees to understand how much impact did that have. So you might ask survey questions like, that include a Likert scale, something like, I have a better understanding of depression as a result of attending the lunch and learn, and people can say strongly agree, somewhat agree. Again, you get the idea. You put a scale on it, but a lot of surveying of employees, each time you hold an event or engage in an initiative will give you a real sense of the impact, because impact is key. That's where you measure your success. Also collecting aggregated, because EAP data is confidential, but this is where you work with your EAP to understand what are baseline numbers of people using the EAP services and supports going into our mental health initiative, and then look again at 3, 6, and 12 months following your big initiative. And it doesn't have to be a one-time initiative. It may be an initiative you plan throughout the year. So then you might want to look at your numbers at 12 months, your data at 12 months, your data at 24 months, your data at 3 years, and really get a sense of how are we doing in terms of creating that culture of caring. Also analyzing, as I mentioned earlier, your intranet, email, and web analytics. As you're doing an initiative throughout the year, and maybe it's every month, really think about posting something new and getting the word out that new information is available, a web-based information is available, and then really look at your data analytics, but continually remind people it's there. You can certainly track employee engagement. So if you've announced an ERG, think about and look at participation, get feedback from managers. What are they hearing from people who are engaging in the initiative, who are attending events? Is there any kind of buzz going on within the organization around what the mental health initiative means for people? Look at your participation in trainings, in lunch and learns, in workshops. You know, what is your attendance at speaker events? Because this will allow you to really continually improve how you reach people with information and who you bring in as speakers to keep it exciting and interesting and keep people engaged. Next slide. Then, of course, your implementation plan is very important. You want to have a communication plan. Again, this is where you can create your custom messaging, identify with your communications team or just amongst yourself if you're a smaller organization, all the vehicles and channels you have for disseminating good information, and plan the frequency of this. So maybe you want to do a 6-month initiative. How often is it that you will share this information? We like to say it's a really great idea to do kind of a drip, drip, drip. So it's not a one-time check the box. We did our mental health 1-month activity. You know, really keep information flowing if you can all year long. And again, it doesn't have to be a big, giant campaign. It can be a large campaign with smaller resources coming out throughout the year. Think about roles and responsibilities. Who's going to do what? And who's going to be involved in the planning, and then really make sure everybody's clear on what the roles and responsibilities are. And resources, look at what you currently have, and then look at gaps for resource development. And we're going to share some resources we have available through Right Direction that you can use right away. But there's a lot out there. There's information on Right Direction. There's information on the Center for Workplace Mental Health. There's a lot out there to use. So you don't have to reinvent the wheel. Although you might want to create some resources that are specific to your culture and your organization. Many organizations do that as well. Again, leverage influence. This is where you notify your influential team members and leaders and secure their support so that they're kind of talking it up and they're really engaged with you in promoting the initiative that you're doing around mental health. And finally, time frame. You know, what is your timeline of initiation or for the initiative? And what are your milestones? What's your launch date? Really have all that ready to go so that everybody's clear on the timeframes. Next slide. And then let's launch. So ideally, you want to launch a mental health initiative with messaging from your leadership. We have seen examples of CEOs and small business owners and other leaders getting excited about the fact that the organization is addressing mental health. And what better way is there to show a serious commitment on the part of the organization to mental health and a caring culture? Also, you want to measure your results, and we shared some ideas on how to do that. You may have other ideas that will work well as well. And then stay current, refresh the education awareness and engagement tools as needed. This is something, again, you don't have to reinvent the wheel. There's a lot already out there for you to use in your initiative. Even if you pick it up from other places like Right Direction and you put it into your branded and culturally appropriate materials. And then finally, compile lessons learned as you go along through the process of launching the initiative. You want continuous quality improvement for this and future initiatives. So really, as a group, whoever you pull together to be involved in this, think about what worked really well, what could we refine in the future to work better, what is it that we can do to really make this take off, to use the rocket analogy here. So let's launch. So if you go to the next slide, we're going to share with you what's available from Right Direction. Now, Right Direction was developed for this very purpose. It has all kinds of resources that are available for you to use, free to you, researched, well thought through, good quality materials that you can pick from and use in your initiative. So think about incorporating some of these. And again, in the chat, we're going to share the links to the materials that we reference. So this is really the resources and program we have available to you that you can use in your organization. So if you go to the next slide. And I know this looks very busy, but we wanted to give you a direct opportunity to see what we have on the Right Direction site. So let's say you decide, okay, we want to do some intranet postings and we want to do some newsletter, e-news articles that really focus on depression awareness. We have, at the link provided here and that Emma's going to share, we have a resource on the signs of depression and what to do. So on your intranet, you might want to say something like, we know that many people develop depression and can function at a very high level with depression. And we want to make sure, but yet only half of people with depression get the help they need. So we want to encourage anyone who may be experiencing depression to get the help they need. Here are the signs, and you can take the signs directly from what we have here available. So we want to encourage you, if you feel like you may be experiencing any of these signs or symptoms, it's important that you seek help. Here's how you can do it within our organization. You can start with our EAP. You can talk to your primary care provider. You can use our benefit plan to connect with a therapist or a specialist in the mental health field, like a psychiatrist. So again, simple opportunity to lift what we have on Right Direction, put it in you can brand it and customize it for your organization and put it on your intranet or in your e-newsletter so that people understand we are an organization that is committed to a better understanding of depression and is committed to making sure that we are connected with care when it's needed. So if you go to the next slide. The second thing is we also have, we have a resource on burnout. So we know with the pandemic, I like to say we're in a trifecta, right? We are in a global pandemic that is historic in scope. We have racial injustice and major concerns about racial issues globally. We also know there's been a lot of political tension over the last few years, and we know there's been an economic downturn. So a lot of people have lost jobs. We also know that people are stressed. So those of us who are working are juggling many things. Those with children are juggling their schedules. We know women are leaving the workplace in high numbers because they often take on caregiver responsibility. So burnout is a big concern, which is why we developed this resource on Right Direction. So what you might want to do, again, this is something you can share in an e-newsletter. You can share this at a town hall. You can open up by saying, the World Health Organization has defined 3 main characteristics of burnout, and we wanted to make you aware of them. And we also want to share with you what you can do as individuals if you're experiencing burnout, and what we're doing as an organization to help ensure that we're addressing the reality that people are experiencing high levels of stress that can lead to burnout, because burnout can lead to physical issues and mental health issues. Again, you're sending that message, we care about your mental health. So here we have in the right direction material, great information on burnout, and we want to really help people who may be experiencing burnout understand what to do so they do not ultimately end up with excessive levels of stress that lead to depression, that can lead to complicated conditions that really impact our mental health and well-being, which is first and foremost importance, but also this impacts productivity, it impacts performance, it impacts retention, it impacts disability. These are all key issues that really, as an organization, we want to see addressed. So if you go to the next slide. We also have a series of customizable posters, and I wanted to show you one. We have this general one we have available that shows the bear, the right direction bear, who is trying to bear with it by, with this huge stack of paper, and clearly is struggling with getting a whole lot of work done. So the point of this, though, is that you can customize these posters. And again, these posters can go in a physical setting, or they can go in a virtual setting. You could have a virtual meeting in which you share a poster like this. Now, what we wanted to show you is on the left side, this is a poster that you can add your logo to. I know it's not super easy to see, but we added our logo for the American Psychiatric Association Foundation Center for Workplace Mental Health. So you can customize this with your logo, and it explains how to do it on this webpage. You can also customize on the lower circle who someone should contact if they are experiencing the early signs of depression. So those are defined within the poster, which you'll see from the link below. And you can fill in whether you want someone to reach out to HR, to reach out to an internal contact, to reach out to the EAP. You can fill in that specific information so that it says, if you're experiencing that, don't wait, get help. And if someone's walking by it in the hall, they may look at it and really think, oh, that's me. Or if they're seeing it on your intranet, they can really recognize, oh, those are the signs. Okay, I'm experiencing that. And there is conveniently the EAP number. So again, we just want to make you aware. So this is one of our posters. We also have posters representing the school environment, a healthcare setting, and we'll continue to build these posters over time. So there's a series of them depending on the industry you're in, and we'll keep adding to those so that it fits within different industries and different work cultures that exist out there. So those are a nice, different kind of way to really communicate about depression and the importance of getting help. Next slide. We have done a series of virtual town halls, and I mentioned to you Changing the Conversation, which was very well received. We did have 3 professionals, all living with diagnoses, as I said, all part of the partnership we have with the Stability Network, a wonderful organization of professional speakers who talk about their diagnoses, including depression and others, and how they have achieved success at extremely high levels. So we have these virtual town halls. You could share that with your employees. You could hold, we've also had them on addressing loneliness, race, mental health, and equity. You could also share this with your leadership so that your managers and your leaders are aware of, have a better understanding of these topics and how these issues impact the workplace. So you can either direct individual employees to them, or you can direct managers to them, or as HR professionals or professionals who work with HR, you can gain a better understanding of these key issues. And again, we are very selective in our virtual town halls. We are selecting issues that are of the most importance at the moment. So loneliness is a huge concern to many with remote working, but also it was an issue before we went into the pandemic, and it's a growing concern globally. And then also race, mental health, and equity. We were fortunate to have Facebook sharing with us the great things they've done as an organization, along with Dr. Corinne Glover, a psychiatrist who's very well versed on race and equity and inclusion issues. And so we really pride ourselves on high caliber presentations, but you can also do your own. So if you want to invite in a speaker, the nice thing about having your own virtual town halls, you can invite experts, you can record it, and then you can share it on your intranet or however you share information with employees. So again, this is a great way to get the word out. You can either use what we have available or create your own. And it's pretty simple to develop these, and they are very high impact. People really appreciate information sharing in new multimedia ways. So if you go to the next slide. We also wanted to share with you that on the Right Direction website, we do have a calendar for the whole year of different months that are marked that you might want to consider for mental health initiatives. So almost every month of the year has a significant mental health event or marker to represent issues of great importance in the mental health. So whether it's stress awareness, LGBTQ Pride Month, National Suicide Prevention Month, we've shared with you in the middle column, there's of course the month, and then the middle column shows what the days that are, what the month is marked for. And then there are some programming ideas and resource promotion, but of course, you can come up with your own ways to mark all of these dates. And we didn't put all 12 months, it was a matter of space, but you get the idea. And it gives you a great way to say to people, it's Mental Health Awareness Month in May, or it's, we want to, in December, combat holiday and seasonal stress. Here are 10 things you should know about stress management. So again, here we are sharing information, and you can make the connection from stress has a direct connection to depression, anxiety, and other mental health issues. So we want to make sure that people get the help they need in stress management when they need it. Now, if you were to have a virtual town hall in which you invited in a dynamic speaker, you could tie all that together as part of your mental health initiative to do in December to remind people it's a stressful time of year and the best of times. So again, take a look at our calendar. You might want to bring this to your initiative team and say, let's decide when we'll do our initiative based on these specific months that during which we honor certain topics, and that helps you really build something that's relevant in terms of you know, the month. So if you go to the next slide. Also wanted to mention that it's, you know, we think Right Direction has amazing resources, and we've shared them with you here. We also have resources at the Center for Workplace Mental Health. We just put out a May is Mental Health Month toolkit in late April. The point of this is to say you can get resources from lots of different places, and we like to promote the resources of many others, as we've done here and we've done in our virtual town halls. And Right Direction will continue to, we link to other resources. We work with partner organizations like NAMI, like Mental Health America, and others, lots of business groups on health. So we like to promote those resources of others. We did want to point out here that in our May is Mental Health Month toolkit, we do talk about supporting resilience in the workplace. So that might be a great way to share how you might promote resilience to your employees as you're really thinking about what do we want to post on our intranet? What do we want to put in our newsletter? What do we want to say to people as we're talking about mental health in the workplace? So if you go to the next slide. I did want to mention too that we have a training for managers, people manager training called Notice, Talk, Act at Work. We know how important it is for managers, especially to understand the how to notice what may be early warning signs of depression and other conditions, how to comfortably start a conversation, and how to act by, again, connecting people to what's available in services and supports. So we did want to mention that we have a people manager training, and we've been promoting that through Right Direction as part of our partnership. So we have that available as well. Lots of resources there on our website. If you go to the next slide. At this point, I'm going to turn it over to Sean because we have had the opportunity to work with a number of different companies that are doing really amazing work on workplace mental health. So we wanted to share some of that with you, and I'll pass it over to Sean. Thank you.
Thank you, Darcy. One of the questions that we're often asked is, what are other companies doing? What are other employers doing? What can we do that, other companies maybe can't do? And just give us some ideas. And so one of the things we wanted to provide you with are, first of all, some of the companies that are doing it. And there are a lot. I think about 90% of companies, CEOs have mentioned that they want to prioritize mental health at work. So there is a big movement towards prioritizing mental health at work. Next slide, please. So here are just kind of a list of different employers, and I'm going to highlight a few things that different employers have done, that some are on this list, some are not. So one employer, for example, Citigroup, they have the new CEO came in and said, we need a day to decompress every year and just reset. And so they called it Citi Reset Day, where they're going to reduce stress that day and try to limit the amount of actual work at work. And then they also provided this kind of ban for no internal video calls on Fridays. And that is just to kind of help, lighten the load a little bit for different things. I know that Goldman Sachs has done some work with reducing work hours for a lot of the bankers who were having, 100-hour work weeks, especially when they were young, right out of school. And so that was something that they have been looking into. Maybelline has a Brave Together campaign that they put together to destigmatize anxiety and depression. This is really interesting because they've looked at targeting kind of a specific segment of the population, and this is actually more towards younger women. And they also do training for managers in mental health awareness and people training, such as the one that Darcy had mentioned in the Notice, Talk, Act at Work. AT&T has done some great things. They have a Stamp Out Stigma campaign to pledge to reduce mental health stigma. They have a Your Health Matters program to increase access to care via telemedicine and different options. And another thing that I think is really unique that they're doing is they're partnering with other organizations, nonprofit organizations in different locations in order to normalize mental health therapy to staff and to customers. So they're actually trying to get out in front of customers as well to try to just be more holistic in their approach to destigmatizing depression and mental health conditions. Salesforce has done some really, really terrific things on their website. They have a thing called Be Well Together video series. They actually have a bee there, so it's kind of cool. But their video series has speakers and experts that provide tips, resources, and insights into health and well-being. It's open to the public. They also have designed a kind of a wellness playbook in order for other companies to use based on some of their lessons learned and what they've spoken to with other companies. One of my favorite companies that I always kind of mention is Ocean Spray, and people are like, oh, the cranberry juice, right? They actually have something really terrific for their employees. A lot of employees, one of the biggest barriers for getting help, for help seeking, and as Darcy mentioned, less than 50% of people with a condition do, is actually not so much stigma anymore. Stigma is a big component, but the biggest is actually costs. So what Ocean Spray did is they decided they were going to help subsidize behavioral health costs for their employees. And they actually do it to a level of 100%, which is pretty remarkable. Twitter, the technology platform, does some wonderful things. They also pay for 100% of healthcare premiums, and they compensate for mental health care as well into that. Starbucks is another company. Everyone probably has had Starbucks coffee within the last couple months. They have offered a program where they give employees and their family members 20 free counseling sessions a year. And they expanded their mental health benefits through their EAP for those that work 20 or more hours per week through different companies that they have partnered with. Target offers their US employees access to free online resources to support their mental, emotional, and physical health. They have access to a website called Daylight, as well as an app to help navigate users through stress and worry. And they provide self-help tools as well to help with sleep. A number of different companies have these things. My company, for example, Employers Health, our company has phenomenal benefits. One of the things that we do is we have Headspace that's provided for free. Our company also pays for all of our premiums for healthcare. And we're a smaller company, so we're not a company that has thousands of people. In fact, we have under 50 employees. So just because you're not a big employer, just because you don't have a lot of employees, doesn't mean you can't, address this issue, prioritize this issue, and do certain things to do this. Another thing that our company does that I think is kind of unique is we have these things called First Fridays. So the first Friday of every month, although we're not very strict with it being the first Friday, but usually one Friday of every month, we do something that has to do with team bonding. So that could be, for example, last week we had board games and we got some cookies that were brought in, and we've had other ones where we went to, we went putt-putt golfing. And so there's different things that we've done as a team to try to bond and just kind of decompress a little bit. And we have that for it's usually Friday afternoon from 2 to 5 that we have that. And it's really cool. It's a really great program. And I encourage other companies to kind of think like that and think about different ways that they can help their employees just be happier. Because as we know, happy employees are more productive, better retention, better customer service. All right, and I think that is it. Emma, if you can go to the next slide for me, please. Great. So before we get to questions, we'd like to thank the generous support from our funders, Takeda and Lundbeck, who have helped make Right Direction possible. Next slide, please. We encourage you to check out our website at rightdirectionforme.com for resources, guidance, and best practices for mental health in the workplace. Also, please see our website for information on upcoming events and webinars. Next slide, please. That's where you can go. Next slide, please. All right, so now we can begin answering audience questions. Darcy, can you jump back on for this?
Yeah, there we go. There's just a delay.
Great, no problem.
Yeah.
All right, so we have several questions. I'll get to one of the first ones. What are some tips on how to discuss mental health in the workplace? If you don't mind, I'll take an initial stab at that. I think one of the big things to me is doing it in a way that shows compassion and empathy and is also non-intrusive. I think as people, we often can read other people and see if there's something else that's wrong. And at that point, when we notice there's something else is wrong, and typically that's something that's like a contrast in their behavior or their personality or their actions, we then need to have the courage to ask them, hey, what's going on? Or, I've noticed you haven't been like yourself recently. Or, is everything okay? And I think that the key for this isn't just, the question itself. I think there's two things you can think of. One, you can ask twice. Typically, if someone says, hey, are you okay? Or what's going on? You have a natural, response ready. But that's not necessarily, that's more of a social kind of construct. If you ask a second time, it tells a person, hey, I really want to know. I'm really concerned. The other thing I would say is looking at, how you ask that question. There's a different thing than saying, hey, are you okay? Versus, hey, are you okay? It shows a deeper amount of investment. Another thing I would mention is once you, kind of bring that up, really asking, hey, how can I help? And that's really important to ask, because not only are you conveying that you're concerned, but you're saying, I am willing to invest my time and energy to do more than just, listen and hear what you have to say. And I think that really makes a lot of difference with people. And the final thing I'll say about this, and then Darcy, if you have anything to chime in, the final thing I'll say is follow up. If someone's going through something really, a really tough situation, follow up. I recently had a manager of mine who I was going through some things, and they checked up on me, a couple of days later and said, hey, is everything going okay? And, that means a lot. That personally was a huge thing for me. And it just tells me I have their support and that they care. One last thing that I just mentioned, sorry, is try to make sure that when they start opening up, you listen. You don't need to fix things. A lot of times people just need an ear to listen to them. So just give them that ear, listen to what they have to say, and how can I help? Darcy, what are your thoughts on that?
Yeah, I think you did a great job of really hitting the high points. I mean, it's always good to use I statements. In our training, we talk about I statements because it avoids putting people on the defensive. So, and being objective about what you're seeing. So if you're a people manager, for example, saying something like, I've noticed that you've missed the last 2 deadlines and you showed up late to the meeting. This is not like you. I'm concerned and I'm wondering what's happening. And again, an open-ended question really makes it easier to hopefully get someone to talk about what they may be experiencing. Never a good idea to be a diagnostician, because unless you're a clinician, of course, but if you're not, then really talk about what you're seeing in performance, in social connection, in maybe changes around behavior, mood, thinking, appearance. I mean, it's hard with appearance, but really using I statements so they're not in the defensive. I think the other thing is trust. So if you are a people manager and you've had a bit of a contentious relationship with someone who's reporting to you, you may not be the best person to approach someone who is experiencing struggles. I mean, you may want to think about, because obviously performance matters when you're a people manager, so you do need to address performance. But when it comes to concerns around mental health, you may want to think about whether there's someone else. And again, confidentiality matters and privacy matters. So it's a delicate situation, but ideally you want to approach someone when you have a relationship of trust. So, and I think what Sean said about being a good listener, we have a tendency to jump in with solutions and not really just listen to what someone has to say. And as Sean shared, I mean, sometimes all someone needs is just some kind words. They may be sort of at that tipping point of I'm not doing well, yet showing us some compassion and empathy could really help them tip into I'm doing better. The other thing is, just because as a people manager, if you are talking with someone you are concerned about, let's say someone seems really down and they're not themselves and they're not showing up on time and they just look like something is really distressing to them. And maybe they are experiencing depression, for example. Let's talk about depression. First of all, I statements, sharing what you're observing. And even if you get this sort of, and we hear this a lot, we get asked a lot from people managers around, well, people don't want to hear anything about it. They don't want to share. There's no way. Just sharing information about the EAP and other resources you have available, even if the person seems completely unreceptive, doesn't mean they won't go ahead and use that information you've shared. And they may not want you to know about the fact that they're using it, but that's okay. What's important is that they've connected with care. So don't be afraid to share it. And as Sean said, check back in. That makes all the difference. So I did see there was a question that came in, Sean, that I think is a really good question around what about using an internal speaker? We mentioned the stability network. What about using an internal speaker who's an employee of the organization? And my response to that is I know organizations that have done that, and I think it works exceptionally well. I guess I have a couple thoughts about that. One is I would want to have more than one conversation with the person to make sure they're really comfortable. I would want to, because again, I think it's, you want to make sure that someone is, doing it for the right reasons. So I think that, having an employee who says, as we did on our Changing the Conversation, who says, I needed help, I got help, and it was great. And I'm in a really good place, and I am so glad I did all of that. That's perfect. So if you have an employee internally who will do that, that's great. I mean, my only fear sometimes is I would want to make sure that someone was in a healthy place themselves before they shared. They really felt like they were in a good, solid, healthy place to share that kind of information, as would be true with any health information. It's not just mental health. So I think it's great if you can find someone internally. It's all the better if it's someone in a leadership role, because that sends a message that, especially if a leader can say, I needed help, I got help, and I'm doing great. That's a great message to share. So, Sean, I don't know if you have thoughts on that.
I mean, I really just quick, you pretty much hit all the major points. I think if you're going to do something like that, it really helps if you have someone that kicks it off who's a leader, who is in leadership, someone who other people can look at and they can say, okay, well, it's obviously safe to talk about work because our CEO's doing it, and they have deemed it then as a part of the culture. I think no matter what, that's a very powerful thing. Even if you don't do an initiative where you have employees speaking, having a leader to email and saying, hey, we're prioritizing this. Hey, I want to tell you a story about something that happened to me or something that happened to my family. I mean, everybody has had some level of impact from mental health. And so being able to share that tells a lot of employees, hey, it's safe to talk about at work. And that's something that is particularly important, because a lot of people who are employees, they don't necessarily want to talk about it at work because they feel, hey, am I not going to be considered for a promotion? Hey, are they going to hold this against me? There's all that psychological safety that needs to be thought of. So I think it's really powerful for a leader to jump on. For our next question was, how can we address mental health in the workplace on a more limited budget? So I'll kick it off real quick. I think some of the things I mentioned were really easy. Having a first Friday every month is really something that helps promote team bonding, which I think is huge, to just be able to work with different people among your organization. That's a small thing. If you have health insurance or you cover medical plans, you have medical providers, ask them what else they can do. A lot of times they can do other things and there's no additional cost to it. In fact, one of the people who have used Right Direction the most, and we've talked with the most and had her on in October, I think, of last year, Kim Hauga from Kent State, she completely innovated her whole wellness culture. And she did it using the existing program she already had. She didn't pay anything extra. And she just created a monthly cadence of providing some level of programming, even if it's just an email saying, hey, we want you to know that we have your back. Here are your benefits if you're struggling. Here are some tips. It doesn't have to be something where you bring someone in to talk. You don't need a celebrity to come in and meet with you guys. It's really something as some of the small things to just remind people that you have benefits that help with this. Darcy, do you have any other additional things for a company with limited budget?
No, I think you hit the nail on the head. I mean, we have all this research-based, high-quality information on the Right Direction site. There's other information out there, so doing a little bit of research to see what's out there and then using it because it's there for your use is really helpful. And again, to bring your team together and decide, what do we want to do? And surveying is easy to do. I think this is a question we get a lot from smaller and mid-sized companies, is we don't necessarily have the budget that large companies have. And I've seen many small and mid-sized companies do amazing work and we've used some of that in putting together our how to plan for your initiative. So I would say you don't need a big budget. Make sure you use reliable information though, of course. And there is reliable information out there. And I noticed that another question came in that's related to this, Sean, asking, what is the best way to base the wellness program yearly calendar on? Like, how do you decide what to do when? Do you use monthly topics? Is there another way to structure it? And my response is, this is where I think pulling your team together and really strategizing on what makes the most sense. I happen to think monthly topics are great. You might want to have one topic throughout the year that you really present in all different unique ways. So maybe you use depression awareness and you decide we want to, in January, we want to have a speaker come in. In February, we want to post some new information on our intranet. In March, you could also tie it to things like Stress Awareness Month, Suicide Prevention Month. So again, you could take one topic and weave it throughout the year around other events that are happening. So, or you could just decide we're going to do one topic and we're going to drip, drip, drip info about it out. And at the end of the year, we're going to really look critically at our EAP data. We're going to look critically at our benefits aggregated, non-identifiable information from our benefits plan. We are going to survey employees to see how well we did in raising depression awareness. And so there's just so many ways to go about it. But this is where I think your initiative that you use the planning group with matter. To plan with the group and decide how do we want to do this really matters.
I agree. I think when I look at this, sometimes I think about corporate social responsibility initiatives that a lot of corporations have, and they often have a central theme, and then they do different things around that theme every month to kind of make sure nothing's stale. So just unique ways to present that information, and you can pick as broad of a topic as you want, or you can pick something more narrow. And you can think, if, like, for example, if you say, hey, we really want to address depression this year, well, what are some things we can think about? One thing you can think about is stress management. You can think about resiliency. You can think about mindfulness. There's a lot of different things you can do programmatically, as well as just, gratitude. All these different things that you can do to really emphasize that and promote that. Another question we have is, how can we address the mental health needs of remote workers? My thought has always been for remote workers is that you need to establish some type of structure. The reason is you don't get to see them as often as someone in a physical workplace. So you need to kind of pre-program in check-ins, and these check-ins can occur when you have performance reviews or when you have, meetings, but you want to have those one-on-ones, and you want to have that as an opportunity for you to kind of see the person and say, hey, what's going on? Is everything okay? You're not only establishing rapport, but you're trying to find out, how is their headspace right now? Do they feel productive? Are there things I need to be considerate of? What are there any things that I'm doing maybe as a manager that I need to reevaluate? One of the things I always try to do is on any new project is set expectations. And I think it's interesting because expectations, a lot of times people say, I expect this from them. But I always think about it as a two-way street. I expect this from them. I always then say, hey, is this feasible? Is this timeline feasible? Can you do this? Do you need any help for this? But then I say, what are your expectations of me, or should they be of me, so that you can be successful in this? And I think it's really important to get that kind of feedback, because if they need something else from you, this gives them the opportunity to do that. And it also conveys to them that you really care and you're really there to support them. One of my managers once told me that I'm only successful if everybody under me is successful. And I think that kind of mentality is really powerful for this. So for remote workers, I always try to have that, setting those structures, having those check-ins, the questions, are you okay? How's everything going? And if I see that something's wrong, but they're not comfortable talking about it, one of the things you can do is kind of be vulnerable with them. That can help people open up. Or you can just say, well, if you need to talk to anybody, or if you're going through anything, just let me know. We have great benefits. You don't have to be intrusive about it. You don't have to force them through it. You can just make suggestions in a way that just says, hey, if you're interested in this, we have this, here's the information, and I'm here to help if you need it. Darcy, what do you think?
Yeah, I agree. I think everything you said makes a huge amount of sense. I think one thing that's important to remember too, or as an organization, is that younger employees are expecting to see mental health visible within organizations. We've done it, the APA has done surveys of young people in the workplace who have said in higher numbers than older generations, that, you know, the 18 to 29 group, they have said their expectation is mental health will be visible. So if you want to retain good talent, and they want to be more open about it, they don't always feel safe being open about it, but they want to be open about it. So there's a difference. So if you want to be an organization that retains your high performing talent, especially in the younger age groups, where we know from data that's been collected that younger people in the 18 to 29 age group are experiencing depression and anxiety at higher levels. If you want to retain that talent, it's really important to think about, how are we sharing mental health as a topic within our organization? How are we showing that we care about our employees, all employees, care about their mental health and well-being? What is it we are doing to make mental health visible? And that's where these initiatives really come into play. I think whether you're working remotely or in the office, really the issues are very much the same. You know, it's really keeping an eye out for changes that you may be seeing in employees that suggest they're struggling with something like depression. You know, there's a great quote that came from Peter Drucker, that culture eats strategy for breakfast. And so that is why I think, and that's from, you know, a long time ago, that he wrote In Search of Excellence and other good business books that are highly regarded. And I think that this idea that people are looking for cultures, organizational cultures that show that the organization cares about their people. So mental health is such a great way to show that you care, because caring about physical health is something we've done for a long time. Caring about mental health is something we've really accelerated. And, you know, there's a great quote from John Brewer with the Conference Board, who I've worked with, that he put on LinkedIn that I really loved. That is, if you don't care for your people, why should they care about your strategy? And I think that is just so brilliant. But I also wanted to sort of shift it to the positive, to say, to convey this idea that if you care for your people, meaning your people within your organization, they will care about your strategy. So, and I do believe as a nation, employers and workplaces have really, and I think globally, have really woken up to this idea that our mental health matters, that they need to be more engaged on mental health. And hopefully through this conversation, we've been able to really show you how Right Direction is a conduit to really plan your initiative. And hopefully you will see that we've made the resources available. It's why we develop them. We appreciate all of you and the great work you do. So hopefully you'll find what you need. So I don't want to wrap it up, Sean. I just wanted to.
No, I think we're about to wrap it up. I want to say one more thing about remote workers. And I think it's something that I don't know if we touched on that much during the talk. Having really good access to care is so critical. I think I read a statistic the other day that said more than 50% of US counties do not have a psychiatrist.
Mm-hmm.
That is incredible. If you're someone who needs mental health help and you don't have anyone in your county who even practices it, that's really tough. So I think having, you know, talking to your health plan, a lot of health plans now carry digital health options, telemedicine, telepsychiatry, telebehavioral health. Extremely critical to do that. I think especially as more and more people go to either a hybrid physical and remote position or a strictly remote position, having the ability for the individual to do that. I think a lot of times, you know, with current jobs, a lot of people are traveling, and being able to have that access not only makes it easier for you. If you're traveling, you can still meet with your doctor, but it also means you can do it in a more comfortable way from your own, you know, home. It saves you commute time. So if you really want to think about it economically, you know, you're reducing the time they're going to be out of office. So, you know, you can think about all these different things. Darcy, do you have anything else?
Yeah, I have one more suggestion along the lines. For those of you who work in HR and in benefits in particular, consider being a secret shopper with your benefits plan and your EAP, because people have a tremendously challenging time accessing mental health care, navigating the system, finding a mental health provider. that accepts insurance, that is part of the network. Consider being a secret shopper so you can understand whether or not people connect with care. It's a big challenge, and you can do great work on the raising awareness and building a healthy culture and helping people feel psychologically safe. But if they can't get connected to care, then all of your good work has been undermined. So really think about I think that access to care issue you raised, Sean, is so critically important. So consider being a secret shopper just to understand what people experience when they try to connect with mental health care.
That's a great idea. With that, we're at 2 o'clock. Thank you everyone for attending. We hope we gave you a lot of good actionable strategies and insights, and we'll see you at our next virtual event. Thank you.
Thank you all.